This is the Emergency Medical Minute, sponsored by Health One.
So, the Colorado Rapids Stadium just got shut down for disease. Does anybody know which disease this is? The plague. So, this comes from rats and fleas. So, the flea is the carrier, and or the flea transmits, and the rat is the carrier. So, this has been around forever. Obviously, it was the Black Death. It was used in biowarfare ever since the 1400s when people would catapult dead bodies or other animals with it into cities. Yes, it really is. So the bacteria is Yersinia Pestis, and infection can happen with less than 100 bacteria. So very, very infectious. Main mechanism of transfer is airborne. So airborne can travel up to 10 kilometers and infect. The deadliest form is the pulmonary form. People who are untreated with pulmonary form, it's 100% fatality. People who are treated within 24 hours, there can still be a high mortality, up to 20%. So basically it presents kind of like TB, cough, fever, night sweats, and then hemoptysis. So definitely, if someone's been to the Colorado Rapids Stadium or been exposed, they think people in the main area probably won't be infected. They're thinking parking lots or like back areas where the rats were and the fleas were is where it is. So the health department actually shut down the whole stadium because of that. Colorado is actually a place where we see this regularly, not frequently, and it's mainly because of prairie dogs. So prairie dogs can be another carrier, and that's where we usually see it in rural or southern Colorado. So again, prevention. I gave a medical minute a couple days ago about prevention of mosquito type and malaria. So if you're using bug spray or paramethrin spray on your clothes, then you probably won't get a flea bite. So prevention, as always in medicine, is much better than treatment. The other thing we think of when we think of the plague is the bubonic plague. So bubonic comes from the term buboes, which is really just a swollen lymph node that's full of pus, and they can get up to 10 centimeters big, and they necrotize. That can turn into septicemia. You can have a GI form of it too, but again, the pulmonary one is the most deadly. So. All right, so another screening question for our list of 200 screening questions.